Good afternoon, Ms. Delores. My name is Mary Mutegi. I'm the project manager here at Health Impact Ohio. We have a pleasure of meeting with you today, just wanting to learn more about your work as a community health worker. And if you don't mind, if you could just introduce yourself and the agency you work for and maybe how long you've worked there.
Okay. And also, good morning to you, Mary. I am Delores Richardson, a community health worker with Franklin County Public Health. And I've been with them going on a year and a half with Franklin County Public Health.
Great, great. Yeah. What really inspired you to become a community health worker?
What inspired me to become a community health worker is because I saw a need. I was learning about a need. As you know, infant mortality has been on the rise in Ohio. And when I saw the numbers of the infant mortality plot for us in Ohio being such a big city and some of the smaller cities not having that um, those numbers. And so my goddaughter had came and presented me with like, Auntie, I just think this is a good fit for you. And at the time, I was in transition of finding out what would be a good fit for me. I had stayed home for a amount of 5 years to keep my great aunt who moved in with me at the age of 88. She died at 96 years old. And so
Wow.
I had doing a lot of that time of work, did some part-time work. So it struck my heart that I could be of service to someone else. And so I took the class. And after taking the class, I just learned so much from that class that here I am as a community health worker.
Wow. So you already doing the work with your great aunt, not even
Yes,
realizing there's a certification out there that could even add more value to you.
yes.
That's beautiful. That's beautiful. So how does that background working and maybe other backgrounds, how has that influenced your work that you're currently doing with your clients today?
Well, it started out influencing me from, as you know, I worked with infant mortality for a while. And
Mm.
so I also was a teen mother. So that influenced me to just dig my heels in and see if I can be some support in the mental and maternal health uh, base of Celebrate One. And I loved it. And I saw a need. Again, the need was greater than what I could even imagine. My background, as I said, I was a teen mother and I came from a smaller place in this on this earth called by God, West Virginia. So
Okay.
we didn't have the numbers that Ohio had. And so that influenced me to say I can and I will tell my story to some of those moms who felt like they needed that encouragement in order to be a better mom and to get the resources they need and to even join moms to be in different resources to support each other. I was fortunate that I was a teen mom, but I had a support base. So I knew a lot of those resources put a support base around what they needed to be a good mother.
Right. And I remember a couple months ago when you had that presentation, also working with the teenagers and their mental health. I
Mhm.
see you have such a big passion working with that group. Actually, that's quite, I can call it more of a vulnerable group. There's so much that work with the children. There's a lot of work that's done with the adults. But these age group of teenagers, I find it's kind of a neglected age group. And listening to your presentation that time, it was really impressive. So great work. Continue doing that. And I'm sure more people will get into it and, serve that one age group that's mainly forgotten out there in the community. So, in a monthly meeting, I know we did highlight you in regards to the work you're doing there with individuals that have diabetes. Your numbers have been outshining, and I know you're really passionate with also that group of individuals with diabetes. So, based on that success, do you have a story maybe you'd like to share? How are you meeting those goals? How are you able to help, individuals reduce their A1Cs levels? If you have a story that you'd like to really highlight on how you've succeeded in helping clients.
I'm not going to highlight one certain story because I do a wraparound service with, as you know, on our checklist, we ask about the chronic diseases. And
Yes.
when they check that box that they're diabetic or they're borderline diabetic, which 3% of the country is borderline or
Yes.
pre. And
Mhm.
so I take an extra step in doing some of that education that I have learned about diabetes. As you know,
Mhm.
African American families are very, very much impacted with diabetes. So I am not escaped from that, from my parents to siblings having diabetes. So it's a passion for me to have the conversation. So the first thing I do is I build a trust. I build a trust. I find out where they are in their diabetes. Um, have they just been diagnosed, previously diagnosed? Those sort of, I ask some of those perimeters first, and I ask their permission to have the conversation. That is,
Mhm.
if is it comfortable for you to have this conversation with me? I try not to give any information that I know that a doctor should be given, but I want to know that they're relaxed enough to talk to me about it. And when I call them, when I do check-ins, I go when we go through the chronic diseases again, I my question is, how's your A1C?
Mhm.
Tell me what your numbers were today. If you take if I
Mhm.
and I mark whether my clients are people that take it every day, every
Mhm.
other day, whether they take their numbers every, or they wait whether they go to the doctor and take it. I ask the
Mhm.
question, do you know when you feel off balance with your blood sugars? Because you
Mhm.
should know because it's your body. So I try to make them fall in love with their body and what their body's doing to them and make them understand that you don't want your body to turn on you. So that's my
Yes.
conversation around diabetes.
Wow. Yes.
And that's how one of my clients, I was so long, and I guess I was so long in that she would decide to do some exercise because her doctor was constantly telling her it was exercise that she was missing that would get her numbers back. So I have finally got her to start exercising with a group and her in the facility that she lives in. And that just started about 2 weeks ago where she was calling me and saying, we're walking in the morning. It's a group of us that's walking in the morning. And I'm asking her, does she feel better? So
Yeah.
for me, that's a win-win
Yes.
because we know diet and exercise can make a big difference. And also getting them to understand that being diagnosed with this is not a death sentence.
That's
It's
right.
just another way of living your life.
Yes.
Thanksgiving, we had a presentation with, I'm a part of the 100 Black Women National
Okay.
Coalition in Columbus, Ohio. And so we had, our presentation was eating healthy over the holiday. It was about the metabolic syndrome and nutrition, nutritionist was there telling how to fix those smaller plates, get a little exercise in and another smaller plate. So I am, that's a passion of mine to make sure that we have that conversation. But like I said, only with those clients are comfortable enough to have them.
Great. Wow. That's a very great approach. Plus, I'm diabetic myself, and I know that's usually a big challenge. Like you say, Thanksgiving, you look at all that the cranberry and this, and pies and all that. Like, how do you escape these food and just eat the greens? Like it's a tough one. And like you say, it's how do you just enjoy the food, but don't overindulge?
Right, right.
That's it's a tough situation, but I think once you've prepped yourself mentally,
Hmm.
you can achieve it. Yes, you
Yes,
can achieve
yes.
it. But great job with what you're doing. I know, like you said, the numbers in this country are quite high. The lifestyle is quite a difficult one to change, but looking at the numbers that we presented last time, how you've been able to complete all those pathways and help those individuals reduce their A1Cs, gets to better health outcomes, that is really outstanding. So thank you and continue doing the great job.
Thank you.
So, as a community health worker, our goal is to keep educating others, and empowering them with more resources and information. What is the one thing you wish people would understand about your work as a community health worker?
Um, I wish that people would understand that we too are human. And a
Hmm.
lot of what we hear and see in behaviors, we have to sometimes digest ourselves and be
Hmm.
patient with that human side of us
Hmm.
that want to help you. And take some of the advice that we give and know that it's coming from a place of research, education, and support. And so I and not sometimes we're confused with a social worker, and I have to sometimes tell my clients, but I'm your community health worker. And
Otherwise.
to understand that the word community is in there because we serve the community. And all the resources that we give to our clients come from the community. We're just pointing you in the direction of them.
Mhm. Great, great. That's nice. Yeah, a lot of people confuse that one title with social work because you're almost doing the same thing. But I think
Yes,
with the community, you're living in that community, you know?
yes,
A social worker could come from a hospital just to come and see you for a minute, but community, you're living in that community. So everybody gets to know you. So you're more accessible to them.
exactly.
Great. Like you can feel I have a bad cold. We are back again in this winter season. Not sure if it's COVID, is it a flu? Is it, there's all this happening in the, with this cold weather. COVID hasn't gone anywhere. You in your work as a community health worker, have you had this pandemic change your role?
Oh, yes, yes. This pandemic has changed all of our roles, whether we admit it or not. But the reality of it hits you in a different way once you've had COVID.
Yes.
I have just recently struggled with having COVID in September, and I work with clients who've had it. But once you've had it and know the long-term effects it can leave on your body, your center and your questions and your approach to all clients become a little different. Um, I'm asking that question. Have you had your vaccine? If you haven't had your vaccine, why you haven't had your vaccine? Are you going to get a vaccine? I'm keeping my mask on. I'm washing more. I am being very careful. So that approach has changed, but I do it with also with compassion. Is that because sometimes the conversation is had, I'm doing this for your safety. Because sometimes it's kind of hard to sit in a room with a client and they don't have on a mask and you do. And I might have to explain why I have on a mask, and that's okay. And or even ask them if they're not vaccinated, would they mind putting on a mask when I'm around? Because COVID has changed us. It has changed the world that we live in. And that's a conversation that you do have to have.
That's true. That's true.
So that's my approach has changed as to there's some questions I ask before I enter the door. I don't just ask about COVID anymore. I ask about the flu shot. I ask, and see, a lot of my clients are elderly. I ask about shingles. Now I'm asking about monkeypox. I'm asking about measles. All of that protection warrior gear I'm asking about now. So that's how
That's
COVID has changed me. I'm looking at the TV for results. I'm giving out results. I'm giving out pamphlets about what to look for, like for this winter. How safe should you be? How should you keep yourself safe? I'm doing
that's
that now with my clients.
that's nice. That's great. And I would imagine that the response has been positive based on your
Positive
approach.
response, positive. It's like, oh yeah, you reminded me of that. Yes.
Great, great. Thank you so much, Delores. As you're coming to the end of this interview, is there anything else you'd like to add on to this great work that you've been doing in our community?
You know what? I just like to thank everyone involved with the hub and with Franklin County Public Health, it, just pointing me this way so that I can have the opportunity to serve others.
Thank you. Thank you. And we wish you happy holidays.
You too.
Thanks again for taking time to meet with us. And we look forward to seeing you again in the
Okay.
next
Thank
meeting.
you. Thank you.
Thank you so much, Miss Dolores.
You're welcome.